Welcome to New York City Health and Hospital Kings County YouTube podcast. I'm Dr. Melissa Lee, Director of the Lifestyle Medicine Program. We are taking over this season's podcast to really focus on the launch of our Lifestyle Medicine Program. In this episode, Nurse Practitioner Tara Edwards will be joining us to talk about the importance of sleep. Tara's been working as a nurse practitioner in our primary care practice, and she's one of our newest additions to the Lifestyle Medicine team. Welcome, Tara.
Thank you.
All right, so let's kick this off. Tell me a little bit about the importance of sleep and how that helps to sustain us both mentally and physically.
Well, let's just get right into it and talk about how is it important just to understand the body is full of clocks that helps regulate sleep. The body has a main clock known as the suprachiasmatic nucleus and peripheral clocks, which has to be in synchrony. This is called the circadian rhythm. Once your social clock and internal clock are synchronized, then the average person would have an improvement with alertness, better coordination, faster reaction time, improvement in blood pressure, better muscle strength, and cardiovascular efficiency. This is called restorative sleep.
It sounds like all of us should be getting some restorative sleep. It sounds amazing and really interesting that you're talking about circadian rhythms, especially as you think about, time changes and, fallbacks and spring aheads. All right. So tell me, are there short-term and long-term side effects of not getting enough sleep?
Yes. When a person has disrupted sleep and circadian misalignment, this can result in increased metabolic disorders, which shows as an increase in glucose level. You might have a cardiovascular disease, an increase in heart attack, increase in mood and cognition disorder, which show up as impaired memory.
All right. So it really has a profound effect on all different parts of our body. I would say, when you talk about how it affects your appetite and maybe moods, when I find the kids, I have high schoolers at home, on the floor, and then I see all the dishes that are out after night for that late night snacking, then I can tell that these naps that they're taking are not the healthiest things for them. So when my high schooler wakes up and then is tired throughout the day and falling asleep in class, what could be the cause of that?
Well, it's recommended an average adult should get about 7 to 9 hours per day of sleep, which is similar to your adolescent. The amount of sleep you get plays a major role in your functional performance throughout the day.
It really does, doesn't it? I always feel so much better after a good night's sleep. I was reading something about healthcare providers and seeing that, over half of physicians get less than 6 hours of sleep a night. So I would definitely say, doctors should follow their own advice. So tell me a little bit about the function and purpose of our dreams. We hear about REM sleep. What is that?
So REM sleep is called rapid eye movement. So that's REM, which starts within 90 minutes of falling asleep. This is where dreams occur. During this time, your brain processes new information and retain long-term memory, ensure better mental concentration and mood regulation, which is important for your daily performance and overall quality of life.
And so do you have tips for people in terms of things that they should do before bed, or maybe avoid before bed in order to improve the quality of their sleep?
So let's just talk about your sleep environment. So you would try to power down 30 minutes before bedtime, 4 to 5 low-intense activities to prep for bed, such as reading. Use dim lights during late afternoon and evening. Avoid bright lights at night. Try blackout curtains and use an eye mask. Avoid alcohol 3 hours before bedtime. Avoid high-fat, high-sugar content foods. And increase your daytime physical activity.
Increasing your physical activity sounds like a good idea. That definitely helps for a more restful night of sleep. So what do our lifestyle medicine program experts recommend when it comes to sleep?
Well, we utilize a lifestyle prescription for sleep, which is basically individualized recommendation for healthy sleep. The first one is your sleep environment. Use the bed for sleep and sex only for adults. The second is the light exposure. Turn off or dim light 1 hour before bed. The third is dietary recommendations, which is eliminate late night or afternoon after dinner snacking. Fourth would be exercise. Get up and move at least once every hour. The fifth is to minimize stress. Use active relaxation. 1 hour before bed, such as meditation or taking a shower. The sixth and last one is the intensive therapy, the CBT, cognitive behavioral therapy, which is recommended in certain sleeping disorders like insomnia.
All right, so we're going to have to hold ourselves to that get up and move around every hour when we're seeing patients, okay? Help our sleep at night. So to wrap it up today, how do we help our patients implement these recommendations in our lifestyle medicine program?
As a lifestyle medicine provider, we want to provide them with support and tools through coaching to help them become empowered to obtain healthy sleep patterns for improvement of physiological and mental health.
Well, I'm convinced we should go home and go to sleep now. No, I'm just kidding, Tara. Let's make sure that we have some restorative sleep on our agendas and that we can really help support our patients in achieving this, because it sounds like it's going to help them through a lifetime of health. Thanks for being here today.
Thank you for having me.